When performing a 7-site Skinfold assessment, it is important to keep a few things in mind before beginning. First of all, the person you are taking measurements on should be wearing the appropriate attire. All measurements will be taken on the right side of the body. The purpose of this assessment is to determine the amount of subcutaneous fat, which is the fat below the skin. It would be advantageous to mark sites with a pen or a marker so that they are accurate and consistent every time. When using the calipers to measure the body fat, it is important to pinch above or below the mark. Do not pinch the muscle, and do not just pinch the skin only. The 7 sites are the tricep, the subscapular, the suprailiac, the chest/pectoral, the abdominal, the mid-axillary, and the thigh. When taking measurements, the pinch should only be maintained while reading the caliper. The calipers should be placed 1 centimeter away from the thumb and the finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. You will wait 1 to 2 seconds and not any longer before reading the caliper. In order to get a more accurate reading, you can take duplicate measurements at each site and retest if the duplicate measures are not within 1 to 2 millimeters. It is important to also rotate through measurement sites to allow time for skin to regain normal texture and thickness again before re-measuring. Once all the sites are marked, you can begin. The triceps will be a vertical fold on the posterior midline of the upper arm, halfway between the acromion and acromion process, with the arms held freely to the side of the body. Then the subscapular, the diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. You can have your person put their arm at an angle while you do this. Next is the chest or pectoral, a diagonal fold 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. Then the abdominal, a vertical fold 2 centimeters to the right side of the umbilicus. Next, the suprailiac, a diagonal fold in line with the natural angle of the iliac crest taken in the anterior axillary line immediately superior to the iliac crest. Then the mid-axillary, a vertical fold on the mid-axillary line of the level of the xiphoid process of the sternum. And an alternate method is the horizontal fold taken at the level of the xiphoid sternal border at the mid-axillary line. Then the thigh, a vertical fold on the anterior midline of the thigh, halfway between the proximal border of the patella and the inguinal crease. Once all the sites are taken, it is important to use 4 different equations to determine the actual body fat. First, you will use either the male or female body density equation, as shown, and then you will use either the Siri or the Brozek equation to determine the actual body fat percentage.